Hello, everyone. Good evening and welcome to a session on endometriosis awareness. I'm Dr. Shilpa Rao, and with me I have Dr. Vimi, as always, creating awareness each time we have a session. Endometriosis, the silent disease. So, endometriosis is a very enigmatic disease, commonly associated with a reduction of quality of life in women. Trust me, people who have endometriosis can vouch for it, and they would completely agree with me when I say that it affects every aspect of your life. A timely diagnosis and effective management of this disease pose a significant challenge for both clinicians and patients. A proper treatment actually requires multidisciplinary approach to effectively manage the symptoms, because the symptoms are varied. It is just not a reproductive disease. It is something which involves the entire body. So in recent years, a lot of research has been done to develop new therapies for treatment of endometriosis. To understand how these current treatments are, they work, it's very important for everyone to understand the underlying, biochemical abnormalities and also the therapeutic targets. So what exactly happens is exaggerated inflammatory response, along with excess production of estrogen and progesterone resistance, are some of the critical underlying mechanisms that lead to symptoms of endometriosis. Studies have shown that endometriotic implants have impaired molecular and immunological functions. So to understand what goes behind the medical therapy of endometriosis, we have Dr. Vimi, who is an endometriosis excision specialist. So we are going to talk about the medical management of endometriosis, which is an extremely debatable topic when it comes to treatment of endometriosis. And I am Dr. Shilpa. I'm a dentist by profession and an endo survivor myself. Hi, Vimi.
Hi, Shilpa. Nice to see you again.
Absolutely. So, terribly busy month.
And let me tell all our viewers that we are not here to advocate medical therapy. We are here to discuss how it works and where it is used and where it should not be used.
True.
So we believe that medical therapy does not work for endometriosis. It is to make you aware what are the side effects, what you should ask the doctor if they prescribe you medical therapy, and what you should look for if you're searching for an excision surgeon again. So
absolutely,
you should always look for I mentioned that whenever you are going to an endo specialist, do they have a multidisciplinary team or not? Because endo should be addressed at one time. It's not that I'll go and remove the ovarian cyst and leave other endo behind. So it has to be addressed at one go, and all specialties should work together, and the team should be led by a gynecologist who specializes in excision surgeries. So Shilpa, let's start the session.
Absolutely, Vimi. So as we have always said, that excision is the gold standard when it comes to endometriosis. But when it comes to endometriosis, there are a lot of people who prescribe. I mean, I being a patient myself, I was prescribed medical therapy. I was prescribed hormones for years at a stretch. So I wanted to know how is medical therapy really possible in endometriosis, and what exactly is the medical management?
So Shilpa, basically in endometriosis, when the patient presents with pain, so the treatment aims at reduction of pain.
Correct.
So yes, there are some analgesics which are being given, but there are some hormonal therapies which are widely prescribed. And we believe that it is more of pharma driven than it actually works. All these medications which are being prescribed to our patients with endometriosis diagnosis, they usually cause a ovarian suppression. So there is some symptomatic relief, but actually the medicines do not work on the disease. Our aim is to remove the disease. These medications might alleviate your symptoms, but they do have a lot of side effects and long-term effects. Correct. We see many patients coming to us who have taken multiple courses of leupride injections, OCPs, progesterones, and they were never offered a surgery. I don't know why there is so much of hesitation in prescribing surgical treatment to the patients. So, as you have already taken all kinds of medical therapies, I remember you used to tell me you have these side effects and you have taken Leupride, you have tried this medication, you also tried add-back therapy for Leupride to prevent the bone loss, and you have faced all the side effects. So, medical therapy on the disease, it might reduce the symptoms. So it basically causes ovarian suppression, all the medicines.
Absolutely. It's more about, it suppresses the disease. It doesn't stop it. It's endometriosis, as we have already discussed, is a progressive disease.
Yep.
Right. So, I mean, even after so many years of hormonal therapy and medical management, I still ended up with a blockage of intestine. So that means things were just progressing. I was just not offered the right treatment at the right time.
And it becomes more dangerous because where the disease will become silent.
Correct. That's
because
right.
You don't have symptoms and you assume that you're recovering or your medicines are working for the disease. But it is more harmful because the damage still goes on. A nodule compressing on the ureter will cause kidney damage.
Kidney damage, correct.
A nodule on the bowel will cause from subacute to complete obstruction of the bowel, leading to intestinal obstruction.
Correct.
So, a permanent organ damage, we are heading towards permanent organ damage by reducing your symptoms.
True.
And the medical therapy does not act on the disease.
That's right. Completely understand. So we, honestly, there's no point losing your organs, So what are the different medical options which are available and when are they advised?
See, we have, as a first line therapy are the analgesics, right? We give them. The second most commonly used drugs are the oral contraceptive pills.
Correct.
And then we have derivatives of progesterone. Various types of progesterones are available. We also have intrauterine device called as Marina. And we have a danger drug, I would call it, GnRH analogs, which are widely prescribed left and right to endometriosis patients. The moment it is diagnosed, they are being told, you take this, your disease will disappear, you'll be fine.
It's promoted like a magic pill, magic injection.
Yes. No, actually, there were some studies done where GnRH analogs had shown a lot of side effects.
Correct.
But they also studied that in 6 months, the ovarian function prescription to GnRH, it never returned back to the
similar level.
No, baseline levels.
Correct.
But this was never presented in any of the studies. Also, there were some studies where they studied the effect of Leupride on various symptoms like pain, infertility, painful defecation, urination, painful intercourse. So when they found that dyspareunia did not decrease with Leupride, they classified the symptoms into primary and secondary disorders, symptoms. So then they said it works on the primary symptoms. And they tried to hide the fact that it does not work on the painful intercourse.
That's because it's like a very big pharma market out there.
Right.
Behind Leupride.
And most of these papers which were published with Leupride or other analogs supporting its role in endometriosis were either employed by the pharma company or there were some kickbacks involved.
Correct.
So these are, if you ask me, these are the category of drugs we usually prescribed most of the times. We do prescribe to many patients oral contraceptive pills and progesterone derivatives. They usually work well. Post-surgery we prescribe, not pre-surgical. But they also do not remove the disease.
Okay.
So different surgeons have different practices. In our practice, we do give them, if they're not trying for pregnancy, so post-surgery, we do put them on Dynogest or a progesterone derivative. It's not to remove the residual disease or delay the recurrence. but first few periods can be more painful post-excision. So we do give them some oral contraceptives or progesterone preservatives for first few months, and it really works well. This is what I'm talking is post-excision, not pre-excision.
Correct.
Or pre-excision, we do give some medications when the patient is postponing the surgery and she really needs help with her symptoms. Like during the COVID times when we were not operating actively, or we were holding on to the surgical options. That time we did give them some medications to alleviate their symptoms.
Correct.
So
Which
these
is
are
needed.
certain medications where we do prescribe oral contraceptive pills and dinogens, but definitely leupride or GnRH analogs we usually do not prescribe until unless patient has undergone an IVF process or their reproductive endocrinologist or the IVF specialist wants us to give. Maybe they'd give 1 dose or 2 doses just before the transfer or to the pickup. So in those cases, because we work as a team and sometimes they want us to give 1 dose, in those cases, we give 1 dose of GnRH post-surgery.
All right. So even those pills do cause side effects. I mean, I need to tell this to everyone who is listening to it. Depression is one of the biggest symptoms all these drugs give. And it is just not easy when you're dealing with pain, physical pain, and also mental agony that you go through. But saying that, post-surgery, if you have to go for medical therapy, which is obviously, which as Dr. Vimi just said, that it is sometimes required to take care of the pain post-surgery, it's perfectly fine. We just discussed leuprolide injections, which are just given randomly to anyone who has endometriosis without actually telling the patient what is it, what are the side effects, what exactly it does, and are the side effects caused by them permanent or temporary. I remember going through the injections not knowing anything about it until and unless I started facing the side effects because of it. So just explain us what exactly is leuprolide injections and what are the side effects that are faced and are they permanent?
So leuprolide basically is a GnRH analog. So it works on the hypothalamic pituitary axis and it suppresses the ovary, creates a hypoestrogenic state in the body. So ovarian suppression happens completely. It shuts down the cycles and it may make you amenorrheic, no periods at all, and thus it reduces the symptoms. So basically, GnRH analogs shut down the complete system of estrogen and progesterone, which is released from the ovaries. And amenorrhea itself is there, and when amenorrhea is there, you don't get your periods. The ectopic implants, the endometriotic implants are also shut down. There is no inflammation or too much of activity there as well. So there is a temporary relief in your symptoms.
Okay.
But it makes you menopausal. You are deprived of your hormones, which are released by the ovary, a healthy ovary. So short-term side effects, long-term side effects, both are there. Short-term side effects are menopausal symptoms like hot flushes, anxiety, headache, migraine, decreased libido. These are the most common side effects which we face. And forgetfulness, a lot of mood changes, depression, as you mentioned already, it is one of the very, very common symptoms.
Yes.
And not only with GnRH, also with OCP, some patients report depression. Now, long-term effects, bone loss, very, very important. Because it makes you menopausal, there is definite bone loss and increased risk of osteoporosis. The return of ovarian function does not come. So sometimes it may cause a permanent ovarian damage as well. So those who are trying to conceive and those who are looking for fertility options, it may be sometimes very dangerous in some subset of population. And sometimes it may cause what I said, memory loss. Forgetfulness is short-term side effects, but there can be sometimes partial permanent memory loss as well.
But trust me, I still have brain fog.
So many patients do complain of these things: joint pain, decreased libido, insomnia, they can't sleep, anxiety. As it makes you menopausal and it acts on the vascular system also, so chances of hypertension increase. Nerve pain, joint pain, weight gain. These are some of the irreversible symptoms which have been reported and even published in some of the studies. One thing I wanted to tell was, you had mentioned something. I just wanted to tell about that and I forgot. So yes, informed consent.
Yes.
Because you mentioned about it, that patient is not even aware of the side effects.
Correct.
Leave about awareness. They're not even informed what drug is this, why they are giving it.
True.
So there is a term called as informed consent, where patients should be told all the side effects, the advantages, disadvantages, give them all the options, then they can choose. That is what is informed consent. But we have seen that patients are not even told what they are being prescribed. They are just told, just go take this injection and you'll be fine.
Correct. True. That's how it is. I mean, and the worst thing is, even the doctors don't even take you as seriously when you tell them that you're going through certain problems after taking the medication. So I think that's something which is extremely important, because every person is different, every patient is different, right? So not all the symptoms in everyone is going to be similar. If one person would have some symptom, the other one would have some other symptom. But I think that's how it is. But anyways, so now we'll come to something called as Marina. You just said Marina. So a lot of people, a lot of women nowadays are recommended Marina. So what exactly is Marina, and can you tell us about the goods and bads of Marina?
Yeah, absolutely. So Marina is a device. It is called as intrauterine system, which releases levonorgestrel. Levonorgestrel is a type of progesterone. So Marina releases levonorgestrel 20 microgram every day, and it works for 5 years. It is kind of a hormonal contraceptive as well. Like you must have heard about copper T. The copper T is an interval contraceptive which is implanted in the uterus, and it can stay for 3, 5, or 10 years, and it gives you contraceptive effect because of the copper. The device is similar to copper T, but it is a hormonal device and it releases the progesterone hormone.
Correct.
Now, Marina is being advised. Again, I will say that insertion of Marina does not remove your endometriosis.
True.
Post-surgery, we do advise Marina to patients who are not looking for pregnancy and who also have an adenomyotic component.
Yes.
Now, if you have endometriosis and adenomyosis both, if you have a focal adenomyoma, we might do an adenomyomectomy. But now, decision of adenomyomectomy depends from case to case and their needs and requirements. Some women may have mild diffuse adenomyosis. So with endometriosis, suppose I have done a surgery for her and her family is complete. She's not looking for pregnancy options and she wants some relief for the adenomyosis as well, as adenomyosis is a progressive disease and it causes painful periods and heavy bleeding. And she's not of the age that I can remove her uterus. So in those cases, Marina does work because it works locally. It reduces the bleeding and it might make you amenorrheic in over 5 to 6 months. So your pain and amount of bleeding both reduces. Correct. So such cases, Marina is offered and yes, it works very well. So we have to do the selection depending on the patient's age, their requirement, their pathologies. Now, only adenomyosis, no other issues, she does not have endometriosis, can be offered Marina as a first-line option because as we know, adenomyosis, the definitive treatment is hysterectomy. True. And that is the last option we offer. So we try first medical therapy. So adenomyosis is one disease where medical therapy is the first option. as compared to endometriosis, where surgical is the first option.
True.
So women, and all of us know that they can coexist and they can be found isolated as well. When women may have, or a patient may have endometriosis but no adenomyosis, one can have adenomyosis and no endometriosis.
That's
if
right.
you have only adenomyosis, your medical therapy options are hemostatic agents and analgesics to reduce the pain and bleeding as the first line option. Later comes the oral contraceptive pills, progesterone therapy, Marina, IUD, and finally is the hysterectomy. Not only hysterectomy, if you're looking for conservative options, adenomyomectomy. And if you are looking for a definitive option, hysterectomy is the treatment of choice. So medical therapy, as initially you asked me, Shilpa, where we prescribe. So adenomyosis is a disease where medical therapy comes first.
Correct.
Now, Marina, the side effect profile, if we talk, first 3 months of the Marina insertion, you may have spotting and irregular bleeding. So that is one of the major side effects, which we tell all our patients because it troubles them. And most of the cases, it settles down after 3 months or maximum 5 months, it settles down. And once it settles down, it really works well for many of the patients.
Okay.
Otherwise, because it is a locally acting, there are no major side effects reported. Expulsion, coiling of the thread, sometimes very rarely it may go into the abdomen. These are the rare side effect profile of Marina, which we have to keep monitoring. We keep checking their threads. They can check it themselves as well. And replacement of Marina is usually done after 5 years.
Okay.
Some women may not tolerate it. That is like 10 to 15% of the patients.
That's what I was coming to for. I was just about to ask this to you.
10 to 15% of women may not tolerate it. They may have bloating, although it is locally acting, but some women do have the systemic side effects such as depression and mood changes and severe bloating. So when they don't tolerate it or their bleeding is not stopped at all with the Marina, then we have to remove it.
Okay. So because when I went through Marina, I mean, I had adenomyosis and endometriosis, you know that. So when I went through, obviously, I had not gone through an excision surgery, or I was not offered one at that point in time. And I was given Marina. 20 days I had Marina, and I don't remember even one day without painkillers or without a hot water bottle. So I had that kind of pain with Marina. But and also, Vimi, are there chances of Marina getting embedded? Because my Marina had got embedded in the muscle layer.
So we have to remove it. If it is replaced, it has to be removed.
So saying that, a lot of people, a lot of women are fine with Marina. I have seen a lot of them doing really well. So if we come in that 10% or 15% of cases, you really can't help it. But trust me, it's one of the good medicines that I've really seen with women. So I think we have a couple of questions, Vimi. Devanshi is asking, how do you manage patients that have had surgery but are still having symptoms? You there?
Yeah. I can. So what was the question?
So Devanshi asked, how do you manage patients that have had surgery but are still having symptoms?
Devanshi, it depends on again, you have endometriosis and adenomyosis both, or was the complete excision done or not? Second is post-surgery, some dietary changes, lifestyle changes, physiotherapy, acupuncture does help many of the patients. Surgery is just a part of it. We have discussed this in many of our sessions, Shilpa, that surgery is the first step and complete excision is the first step, followed by many other multimodality options which you need to opt and change your lifestyle, do some exercises. Some patients do not respond to pelvic physio, they opt for acupuncture. Some do go for herbal treatment, a lot of dietary changes. These really help. But first we have to see that whether you have undergone a complete excision or not. If there is a residual disease, then your symptoms may be because of that. In those cases, these additional holistic therapy may not work for you. But if the excision was complete and everything went off well and you have adenomyosis component, then also your symptoms persist. In those cases, some medical therapy like Marina we discussed already, and some progesterone, oral progesterones might help you. So it again varies from case to case, and we need to decide depending on the patient's symptomatology, pathophysiology, and their requirement.
Right. And Madhuri asks, what about Orilsa?
Orlisa is again sister concern like GnRH, same side effect. While everything is same, the name has changed. That's all.
Yeah, that's what I thought.
Yeah.
So GnRH, no, absolutely no. Please don't take it. As a patient, I would I would just say don't take it. It will give you everything that you don't want. So any advice for women on medical therapy for endo? I mean, can you give us an insight about what supplements to add when on hormonal medication?
So, Shilpa, many women are given GnRH for more than 3 to 6 months also. So,
Correct.
There they have to give some add-back therapy given also. So, these add-back therapies are very important to prevent you from menopausal symptoms and bone loss, osteoporosis. So they are not given these estrogen, low dose estrogen progesterone therapy we give. If somebody really needs GnRH analogs, there are certain indications where the GnRH are given. I'm talking in general, not only for endometriosis.
Correct.
When they're taking this therapy, they have to be given add-back therapy, which is not given. Some calcium supplements should be given. And yes, some vitamins do help. So these supplements should be added to women who are taking these therapies. Yes, along with this, lifestyle changes do help, pelvic physiotherapy and anti-inflammatory diet, which helps relieving your symptoms a lot.
Okay. Makes sense. There's another question. Medha asks, is it possible for patients to get adenomyosis after endo excision is done at a young age?
Yes.
Unfortunately.
Endometriosis and adenomyosis can happen anytime. If you don't have adenomyosis now, but at a later age, you might get it. No doubt about it. Because as we said, it's a progressive disease. And as your age increases, it might come into picture that adenomyosis is developing now. So it's not that you had endometriosis and adenomyosis will never come. Adenomyosis, as earlier they have seen that it was identified during the middle-aged population. But nowadays with many young girls also we are seeing. But we have also seen that adenomyosis was not there, only endometriosis, but after 10 years, they did show signs of adenomyosis as well. It can develop because it has some genetic association, and the cell rest which gives rise to this adenomyotic and endometriotic tissue, you might develop it later, although you didn't have it right now.
Earlier, yeah. Christina asks, I had laparoscopy in August and had my periods in September. And having it today, it's so painful. Is this normal? I expected minimal pain after surgery.
As I already told, post-surgery, first 2 to 3 periods, 2 to 3 months. Very painful. That's the reason I put them on some kind of progesterone therapy or some oral contraceptive pills. Many doctors do practice that. It is to alleviate your first few cycles symptoms.
Yeah.
So it was very common with more pain during the periods after surgery.
Correct. So Devanshi, you've asked, can you talk a little about anti-inflammatory diet? Have made dietary modifications, no gluten, no dairy, but here in US, they told you cannot be vegetarian. No, I mean, honestly, we have done a complete session on diet for endometriosis, anti-inflammatory diet. You can just check out on the group. There is a complete session on it, and you can be vegetarian and go for anti-inflammatory diet. You really don't have to be a non-vegetarian for anti-inflammatory diet.
Absolutely.
So that's perfectly fine. That's a myth.
So I think so many people are vegan, so
correct.
They're perfectly fine and healthy. So it's not that you can't.
Absolutely. You can be a vegetarian, and I think you can do your anti-inflammatory diet really well. And trust me, diet really helps. It really helps post your surgery. If your excision is done well, then a proper anti-inflammatory diet and lifestyle changes does make a lot of difference. And also try having natural supplements like evening primrose oil and all those capsules, which really help, which really help.
Chamomile tea, dietitian
Chamomile, yeah, chamomile tea. And there is for insomnia, there is a tea called sleepy tea. I mean, those herbs really help in people like me who have suffered because of menopausal effects. It has really made my life a little better, much better actually.
In anti-inflammatory diet also, when we had this session, she had explained like
Yes, chamomile.
many women may not tolerate one kind of diet and they may tolerate some other kind of diet. So all anti-inflammatory options may not work for you. So you have to
make a food diet,
and you have to make your own diet or recipes, and then you adapt to it.
You have to do an elimination diet and you have to do an elimination diet and see what suits you and what doesn't suit you. And
Yes.
And at the end of it, it'll take time. It'll take a couple of months for you to exactly know what works well for you. And once you know what works for you, and then you're there.
And it's you can understand your body better. Sometimes all anti-inflammatory options may not work for you. So you need to
absolutely
choose wisely.
Perfect. So this was like a much needed session, and we've been planning on doing it for a while. Somehow it just could not happen because of the busy schedules and things just kept going on. But I'm so glad that we did this. So Vimi, looking forward to another session soon.
Yeah, always.
Yeah. And thank you everyone who joined us on this live session, and to everyone who's going to catch us later and watch this recorded session. Thanks once again for supporting us, and see you very soon with another session on endometriosis awareness. Thank you and have a lovely evening ahead. Bye-bye.
Thank you. Bye-bye. Thank you, Shilpa.
Thanks, Mimi.